Thank you, Chairman. Good evening. I'm Dr. Han from Jeonnam National University. First of all, it is my great honor to stand here for my presentation. My topic is about the thoracolumbar slope related to worsening of sagittal imbalance and health-related QOL. Primary degenerative sagittal imbalance, one of the adult deformities, gradually increases with aging. It is clear that these sagittal imbalances are associated with health-related QOL. With development of less invasive surgical techniques, pedicle screw system, and bone substitutes, it is recognized as a disease requiring surgical treatment. In addition, when comparing surgical treatment and non-surgical treatment, most papers reveal that postoperative health-related cure is good for patients with deformity. In line with this, various sagittal alignment parameters have been discovered and applied clinically. However, these SAPs are generally applied to evaluate before and after surgery. In high-risk patients such as elderly, deformity correction surgery is not usually recommended because it involves extensive surgery, long operation time, and high blood loss, which lead to marked perioperative morbidity. It was questionable whether these SAPs could predict the progression of patients with PDSI who have not undergone surgery. Therefore, the purpose of this study was to evaluate the natural course of PDSI and its aggravating factors and health-related QOL associated with various SAPs in patients with PDSI who have not undergone surgery. This is a prospective observational cohort study, and we collected participants with stooping posture over 65 years since 2016. Before enrolling subjects, we checked the whole spine standing radiograph to confirm that the volunteers have SVA larger than 5 centimeters. SAPs were measured through whole spine standing radiograph and through MRI, psoas muscle, elector muscle, multifidus muscle volume was measured, and the grade of fat change was evaluated by Gautier classification. Based on serial analysis, PDSI aggravation was defined as the T1PA increased more than 3 degrees and SVA increased more than 3 centimeters compared to baseline. TLS is the angle between the horizontal reference line and the L1 superior end plate. This is a negative value similar to sacral slope. For health-related QOL, BAS score, short form 36, ODI, MMSE were evaluated, and the correlation between SAPs and health-related QOL values were analyzed using Pearson correlation. A total 69 participants were enrolled. Overall, after 2 years, all health-related QOL measures improved compared to baseline, and among them, ODI and short form 36 values improved with statistically significance. Looking at the radiologic results, interestingly, SVA, T1PA, and TLS value were significantly improved. 18 out of 69 had worsened. When analyzed by dividing into the aggravation group and non-aggravation groups, after exclusion SVA and T1PA, which are used to define PDSI aggravation, TLS was only SAP that differs significantly between the two groups. When the correlation was analyzed, SVA, T1PA, TLS values all showed a strong correlation. TLS also correlated ODI with highest Pearson value. When logistic regression analysis was performed with SVA, T1PA, TLS, it was confirmed that TLS above minus 3.5 degree was predicting factors of PDSI aggravation. PDSI is understood as a cumulative result of degenerative changes and natural progression of aging. However, in this study, overall SAPs had not deteriorated and overall health-related QOL measures had improved after 2 years. Until now, factors that worsen or improve of PDSI have not been clearly identified. We are trying to find factors related to PDSI aggravation through prospective observation cohort study. In 2019, we revealed that large PI values and small multifidus muscle were associated with PDSI aggravation. In 2020, we reported the association between squatting position, working hours, and marked sagittal deformity. New SAPs such as T1PA and lumbar pelvic angle have been published, and their relation to health-related QOL is revealed. However, these parameters can cause measurement errors for various reasons. On the contrary, to measure the TLS, whole spine lateral radiograph is not required, and because only the L1 end plate needs to be clearly identified, measurement errors are reduced. In addition, TLS also related health-related QOL, and when it is above minus 3.5 degree, it can predict the PDSI aggravation. Conclusion: PDSI doesn't necessarily worsen with aging. TLS useful for evaluating PDSI along with SVA and T1PA, and easier to measure than other spinal alignment parameters. Also, TLS above minus 3.5 degree can predict PDSI aggravation. Thank you for attention.